Hey guys, it's Kim. It's Friday, March the 20th, and I'm here with an update related to the coronavirus. Some of the things I plan to cover today are food and dining, social distancing and activities, infection control and PPE, time off requests, otherwise known as PTO, and travel, changes, personal responsibility, and of course self-care. I want to talk first about food and dining. The most important thing I want everyone to know is we have enough food. All of our orders are being fulfilled, and Janet has done a great job of ordering extra food as a precaution. Please note that the dining for the elders, Spalding Square and Rehab, continues with in-room dining. Charity Court, no more than 3 to a table. Maria Hall, no more than 3 to a table. Social distancing and activities. Activities is essential for the residents' quality of life. At Nazareth Home, we will continue to do activities in small groups of 10 or less, and please make certain that they are spread 6 feet apart. Mass service. In order to comply with the Archdiocese guidelines and to continue to do the utmost to keep our residents safe, we will no longer have our Sunday or daily Mass services in the chapel. But please note that you can tune in, and please tell the elders that they can tune in to channel 1893 at 11 a.m. for the next 2 weeks. Bridget did go around this afternoon and gave out flyers, but please be present and help the elders with this. Infection control and PPE. What's the number one defense? Hand hygiene. Hand wash as often as possible. If you cannot wash your hands, utilize the hand sanitizer and wait for it to dry to be effective. Shared equipment. We're going to continue to utilize the cleaning products as we always have for shared equipment. Make sure you're wiping them down. We have no active COVID-19 cases, and we need to ensure that if we did have patients or elders who became positive, that we would have the products we need to fight that. PPE. As of today, we currently have PPE in stock. However, there is a worldwide shortage of the personal protective equipment. Going forward, Tom's supply room will be locked, and only specified staff will have a key to that space. Please note that we will be giving out to the nursing staff for each nurse to have on their med cart 3 masks. These will be kept in their narcotic drawers to be used for emergency situations. Infection control and PPE. Shared equipment. We're going to continue utilizing the clean products. Please see the handout here to the right and tells you how to clean and what you use. We have no active cases, and clean based on the shared equipment sheet posted throughout the building. Here's an example. Infection control and PPE. Mask. Due to the limited amount of masks available to all healthcare workers, we need to ensure that we are utilizing these in a smart way. As I just stated, we will have 3 masks on every medication cart that will be kept and counted in the narcotics compartment. If a resident displays respiratory symptoms and we are going to send them out via EMS, the resident will have to wear the mask. Staff are not permitted to wear masks at this time unless it is required to perform their job duties. Time off requests and travel. I spoke with many of the staff members who are in nursing who had requested PTO about their travel plans. Currently, the guidelines do not restrict travel at this time. However, if you were to travel and during that time the guidelines change or you become exposed, you may not be able to return to work, so please keep that in mind. Changes. Beginning Saturday, March 21st, all staff will report to the front lobby when they arrive for their shift. Staff will take their temperature and complete the line list questions and write their name legibly. Please print because we are having difficulty with reading individuals' signatures. There will be 5 binders, one for dietary, environmental services, nursing, therapy, and administration will be kept at the receptionist's desk as it had been. Please see, this is the example. I want to thank Laura and I want to thank Stephanie for putting things together. This is at the front entrance. You see the 4 binders. The sheet is pretty self-explanatory, but I'll go over it. Each day that you come in, now instead of just taking your temperature, you will actually have to record it. You will come in, you want to do good hand hygiene. There will be sanitizer available. You'll pick up the thermometer, and do you want to go ahead and do the thermometer, Laura? Sorry. We're going to do the thermometer. Sorry about that. They're all infrared. This is an example of one. You'll press it near the person's head or near your own head, and then you'll record it. If it says low, that just means it's not close enough. If it says high, you want to do it again. Same thing. Close to the person's forehead, comes back, and we'll have a reading. You need to make sure that you use the alcohol swabs that are being kept near the equipment. Wipe them off each time when you finish using them, and then set them to the side. Thank you. Changes, more changes. New guidelines have come out, and we have adjusted our screening form for the select visitors we are permitting into the building. These visitors have been approved by the DON and are on a list given to the receptionist daily. They will now have to complete this form, take their temperature, and wear a mask while in the building, and continue to be escorted to and from residents' rooms by staff. They must only go to the resident's room and nowhere else. This is the new screening form that we will be using. As you can see, it has the patient name and the room number, the questions that we're all familiar with, and an area where you can record their temperature. For the receptionist, once you get this, you will put it in the appropriate accordion file based on the date of the week, the date for the month. Personal responsibility. That's a huge one, you all. The only way that we're going to get this under control is by community mitigation. Guidelines have been very clear that the best way to prevent the spread of this virus is to social distance. Stay 6 feet away from others. Isolate yourself in your homes and only go out when completely necessary. Your actions can directly affect your neighbors, peers, elders, and family. Please keep this in mind as you go about your day-to-day lives. Most important, self-care. This is scary times, and we want folks to remember to take care of themselves. While we have asked you to monitor your physical health for these symptoms of fever, cough, shortness of breath, we also want you to monitor your mental health. This is an extremely unique situation, and every day there is new information and guidance. The CDC recommends things you can do to support yourself. Take breaks from watching, reading, or listening to the news. Take a break from social media. Hearing about the pandemic repeatedly can be upsetting. Take care of your body. Deep breaths, stretch, meditate, eat healthy, exercise when you can, get plenty of sleep, and avoid alcohol. Make time to unwind. Try to do some other activities you enjoy. Connect with others. Talk with people you trust about your concerns and how you are feeling. Today, some of you, if you've provided us with your email addresses, will have received, Jennifer Smith sent this out earlier. This is a going home checklist. Take a moment to think about today. Acknowledge one thing that was difficult on your shift and let it go. Be proud of the care that you gave today. I know I'm proud of all of us. Consider 3 things that went well. Check on your other coworkers before you leave. Are they okay? Are you okay? We're here for you. We're here to listen and to support you. And then switch your attention to home, rest, and recharge. Most important, always wash your hands, and thanks for all you do. How bad was